I can now report from the whole genome sequence analysis that our current positive cases are a close match to a recent returnee from Sydney who arrived on a managed red zone flight on August 7th, had a day 1 test on the 8th, returning a positive result on the 9th. They were transferred from the Crown Plaza to the Jet Park quarantine facility that same day. This person subsequently became unwell and was moved to Middlemore Hospital on the 16th of August. What this information tells us is that our cases are most likely to have come from the traveller. This is a significant development. It means now we can be fairly certain how and when the virus entered the country, and that based on timelines, there are minimal, possibly only 1 or maybe 2 missing links between this returnee and cases in our current outbreak. And the period in which cases were in the community is relatively short. There is still a chance that additional information could emerge to change this conclusion, so we do need to remain open to other possibilities. That means you will see our public health unit continue to be very cautious around possible places of interest, and you will have seen that in some of those locations of interest to date. However, the balance of evidence now gives us enough confidence to focus our search for that missing link. Our primary lines of investigation are staff at the Crown Plaza Managed Isolation Facility where the returnee was originally based, staff at the Jet Park Quarantine Facility, and other MIQ and border staff involved in their arrival and transport from the airport and between managed isolation facilities. Middlemore Hospital is not a line of investigation at this stage, as the individual was only moved there on the 16th, 1 day before lockdown and days after symptom onset in a number of our other cases. So while today you will see we continue to find cases downstream, there could be relatively few cases upstream, as in people who picked up the virus from the very beginning of the chain. That's simply because it wasn't here for long, we believe, before it was found. On that note, can I thank again our first positive case that was identified on Tuesday. If it wasn't for you getting tested when you did, this could be a much, much more difficult situation. Having said that, I know we're all prepared for cases to get worse before they get better. That is always the pattern in these outbreaks. But today we believe we have uncovered the piece of the puzzle we were looking for, and that means our ability to circle the virus, lock it down, and stamp it out generally has greatly improved.
So today I can report there are 11 new positive cases of Covid-19 in the community. That is since yesterday's 1 p.m. update, taking our total number of community cases all in Auckland to 21. All of these cases here in the community are being transferred safely to the Auckland quarantine facility or are already there under the usual strict infection prevention and control procedures. Now, these new community cases are not unexpected, as the Prime Minister said, and we would expect the number of cases to continue to grow, in particular because of the large number of locations of interest and the mobility of these cases over the few days before the lockdown started. Now, 2 of our community cases were taken to North Shore Hospital overnight. One had worsening symptoms from their COVID, and the other is symptomatic and has underlying conditions. One of these people is in their 20s, the other is in their 40s. Both are in a stable condition.
As signalled yesterday, a phased approach to reopening vaccination sites with the Level 4 protocols in place has now begun. This enables everyone to stay safe while we vaccinate. So please, if you have a booking and you have not had any other communication from your provider, please still go because we're expecting you. Primary care facilities have also resumed carrying out COVID-19 vaccinations today, and with some less urgent appointments being cancelled as a result of Level 4, many now have extra capacity. Our plan is to use that extra capacity to continue with those who are already booked in, but to also bring through essential workers. Our plans to vaccinate these workers starts with those who are customer-facing, who interact with the public as part of their essential work. For example, supermarket workers who may not have been eligible because of their age bans to date. We're working with employers of these essential workforces to identify the individuals, and workers you can expect to hear from your employer with extra details. Cabinet has agreed to make the Pfizer vaccine available for 12 to 15-year-olds. This is not a decision we have taken lightly. Many of us are parents ourselves and take this duty of making decisions about other people's children extremely seriously. But it is safe, and it's the right thing to do. So 12 to 15-year-olds can become eligible and book, along with everyone else that we are opening up to from the 1st of September. We know, though, that a number of these children's parents will already be eligible to book their vaccines. We want to be practical about this. So from tomorrow morning, parents and caregivers who are eligible for their vaccines will also be able to book their 12 to 15-year-olds at the same time. But if you've already booked, then just bring them along. Please just make sure that while you do that, you work hard to keep physical distancing up from others. There are an estimated 265,000 people in the 12 to 15-year-old age bracket, so this is an important next step. And please be assured again, we have more than enough Pfizer vaccines for everyone, including the 12 to 15-year-old age group. Lastly, I know everyone outside Auckland and the Coromandel in particular is anxiously awaiting news on how long their Level 4 conditions will remain in place. Ministers will meet tomorrow morning and will share a decision taken at tomorrow's update. What I'd like to leave with you with today, though, is some optimism, but also a strong serving of caution, as you'd expect. News that we believe we've identified how this Delta variant entered New Zealand should not be underestimated. It means that alongside the what, we now believe we have a good handle on the how and where. That said, it is well known globally that Delta is tougher than previous variants of COVID. So while we have further information to inform our response, we also know it is going to be a tough fight that we all need to play our part in. So please, stay at home, wear a mask if you do need to go out, practice good hygiene, stick to your bubble, and be kind to those around you. While the high numbers of people getting tested has seen some people waiting in queues, I want you to know that you are doing the right thing for yourself, your family, for your community, and for New Zealand. High compliance alongside reports of low vehicle traffic tells me that New Zealanders are following the rules that will work, and our public health units are also reporting that when they're making calls to contacts and close contacts, that there is high compliance with Level 4 requirements. So thank you. Sticking together beats the virus, and together, that's exactly what we are going to do.